Greetings, friends and followers. This is Nurses Talking. I am Dale Barzy. As always, if you like what you see and hear, subscribe, leave us a comment, and let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, it is my great pleasure to welcome Vanessa Abacan. Vanessa is an advanced practice registered nurse and a board certified pediatric clinical specialist out of Texas, USA. So, welcome, Vanessa.
Hello. Thanks for having me.
Thank you for doing this. Thank you for doing this. I appreciate it. So, Vanessa, I always want to know why people are nurses. So, why are you a nurse?
Because I like to make a difference, not just in patients, but also, in the nursing community as a whole. And honestly, it's just been a passion of mine since the inception, since the beginning.
Okay. So, did you have, for it to be a passion of yours from the beginning, did you have contact with any healthcare people or the system?
Yes, so I come from a family of nurses.
Ah.
I'm Filipino, so I feel like we're just born nurses. Um, so my mom was a nurse and my dad is a nurse. Specialty wise, my mom was a mother baby nurse who then got her master's and turned into IBCLC, lactation consultant. And then my dad is also a nurse, but his focus is like adult geriatrics. So they've been like kind of like my inspiration since the beginning. Um,
Mhm.
they did not force me to go into nursing. I just kind of like saw what they did and I'm like, I want to do that.
Yeah,
So here I
yeah.
am.
So it was more showing and less talking. They led by example.
Yes, yes.
Awesome, awesome. So now you have two parents who are nurses, um, and you wanted to be like them. That means they set the bar kind of high. So, what were the challenges for you?
Well, like in the beginning, I was like, I don't think I can do this because I don't like blood. And, like I don't really think that I can, even hold a needle at that. But in terms of challenges, I worked with my mom in the same unit. So I was a mother baby nurse and
Mm,
she was our unit lactation consultant. And it's kind of funny because, we're in a postpartum unit and we would introduce ourselves because we would need to have a rotation with our lactation consultant. And so
mhm,
that day we were rounding and we said hi to the patient. It's like, hi, mom, I'm your lactation consultant today. This is your
mm.
mother baby nurse. And also, I'm her mom. This is my baby kind of thing. And so I was always like Ida's daughter. So kind
Mm,
of being in her shadows, there was a certain expectation. And I had to, kind of fill this standard. Like my mom was an amazing nurse. She was an amazing, super caring, super sweet lactation consultant. And so it was just kind of like, okay, Vanessa, you've got big shoes to fill. And so that was one of my biggest challenges.
yeah. I can imagine how intimidating that could be. So, what areas did you work from? I mean, you ended up in the same specialty as your mother, but how did you get there?
So initially, funny story, I started off with adult gero. So as a, fresh out of school new grad, I did geriatrics. I was in adult med-surg. And then I quickly learned that that is not my thing. I was just like not, I don't know, I could not fit in.
Yeah.
Um, and so my mom was like, hey, why don't you try out, postpartum? We take care of moms and babies. I'm like, you know what? That sounds kind of fun. And she's like, every time you walk in a room, it's like a party because there's balloons and food
Yeah.
everywhere. And it's just a
Yeah.
happy environment. And I'm like, that is definitely a departure from what I'm currently in. So obviously I was open to exploring that. And then I just fell in love with it. And so I kind of dabbled in, mother baby, and then I was also floating to our NICU. But really and truly, deep down, I wanted to delve into the world of pediatrics. And so I know earlier I was telling you about like life happening. And
Yeah.
so my entire like doctorate is in pediatrics. So I'm board certified in pediatrics. But my nursing experience focused mostly on babies and moms.
Mm. Mhm,
But
mhm.
I had the opportunities to work in pediatrics during my journey. And that was really my hope when I went into school is I know I want to end up in pediatrics, so I'm just going to pursue this track. But it just never really happened because when I got a job in pediatrics, COVID happened and they
Ah.
rescinded a lot of the offers. And I'm like, okay, it's not the time, maybe next time. I got another job in pediatrics, but I was not, I had a baby. I had my baby. And I'm like, I need to think about work-life balance here. I can't be
Mhm.
doing that. And then, because at that time, that was kind of like an outpatient urgent care ER setting.
Mm.
And I'm like,
Yeah.
I have a newborn at home. I'm not really sure if I want to work there and bring
Yeah.
home cooties.
Mhm.
So all that to say, like my clinical background and my board certification is in pediatrics, but mostly I worked with mom and babies. So I'm kind
Mhm.
of like everywhere.
But a lot of it is still focused around, the young people. You're working with moms and babies, and basically the goal when you're working with moms and babies is that you're looking to bring a healthy, encourage or help moms to bring healthy children, raise healthy children. What is the one thing you want to get across to them?
Um, Not everything you see on the internet is true. I feel like that
Yes.
statement just kind of like summarizes everything, right? Like we, in this day and age, it's very reliant on Google. Let's Google this, let's Google that. Oh, Mayo Clinic said this, but then really the latest evidence says otherwise. Things change on a constant basis. You may have
Yes.
had your baby 5 years ago. It may not be the same today at this very moment. So I think that's pretty ubiquitous across the board, that is the biggest challenge is you're going against social media here. You're going
Mhm.
against the internet and what they see and what sticks to their minds that may or may not influence their care later on.
Yeah, 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 yeah. And you so eloquently articulated the question, answer to the question I was actually trying to ask. Yes, because in my day, all of these outside forces really, and I say my day, this is my day too. But as a young nurse, as a young midwife, all of these forces, I didn't have all of these outside influences to deal with or to sidetrack, my care of the patient. So yeah, so that's very, very, very cool. But what would you like to see change in nursing, and how can we do it?
Oh, okay, that is a very loaded question.
Mhm,
So, I'm a clinical nurse specialist, so I bring change everywhere I go. I'm
mhm.
literally a walking change agent, and it's not always welcome. People, it's like, you're telling me to do what? Step outside my comfort zone? Oh my goodness. But in today's nursing day and age, what do I want to change? I think that culture of being punitive, um,
Ah,
it's a lot of that I will write you up, or you made a mistake. Let me, I need to enter it in our safety net report or whatever. And
mhm.
before this role, I was in patient safety. And that was the one thing that we really tried to get across is these event reporting tools, they're not meant to be punitive. They're meant to be informative, but there's still that underlying kind of impression that it's negative, that it's bad. But I think if there's one thing that I can change is that perception of you make a mistake and it's just kind of like this big thing that gets blown up and then it gets counted against you, but really it's a learning opportunity.
Yeah. Yeah. Yeah.
And you need to not be fearful of that, because really that mistake is going to be a learning opportunity for us to prevent that from happening to another person, to a different nurse.
Yeah.
So, yeah, I think that is really like very, very common right now that I'm trying to change.
And that is huge, because often when these mistakes happen, they're not really personal failures, they're systemic failures.
Sorry, yes, reach.
They're systemic failures. So it's awesome that this is what you're looking at. I want to ask you what you think of as your greatest achievement so far.
Um, okay, so I have like a professional achievement, and then also wanted to talk about something like, I guess, academic.
Yeah.
So recently I was able to contribute to a textbook. It's
Oh,
a
awesome.
DNP workbook, and it's just kind of surreal seeing my name in a book, and I'm just like,
Yeah.
oh my God. And my last name being ABA, thank you to my husband, I'm always first up on everything. So it was really exciting to be able to say, hey, I contributed to a book. Um, and then in terms of professionally, not that contributing to a book is not professional, but I'm saying like in
Yeah.
my actual job role, um, I had this one moment where I was kind of down and I was feeling like, all right, maybe I'm in over my head here, trying to make a difference, trying to push changes. Maybe it's just not going to happen, because you have those days.
Yeah.
Um, but then one of my nurses comes into my office and she goes, Vanessa, I have this idea. And she tells me about this idea, and she has the concept, but she had no idea how to kind of formulate it and articulate it into a project. And I said, all right, have a seat. Let me, go through this with you. And by the end of that, she was walking off with this big grin on her face, saying, Vanessa, thank you, because I never knew that I could do this. And I never knew that you could turn all of these things, like this mumbled mess in my brain,
Yes.
into something elaborate and something tangible. And I'm like,
Mhm.
that's my job. That's what I'm here for. And I'm here to empower you. And she
Mhm.
was like, you know what? She was just absolutely ready to just go conquer the world when she walked out. And I'm like, you know what, God, you knew exactly what I needed today, huh? Like, you needed me to see that smile on that nurse's face and just kind of redeem this, I don't know, down in the dumps type of day.
Yeah, yeah,
So I
yeah.
think it's like kind of small because it's my daily work, but at the same time, I'm like, this is what I'm doing this for. So
Yes, 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 yes,
hard.
yes, yes, yes. And typically, I ask those questions because I know how hard nursing can be and how sometimes you can get so overwhelmed. And I really want us to every now and then remember those days and those achievements and those things that we have that has lifted us up. So yeah, congratulations on both of those things.
Thank you.
What do you see nursing looking like in the next 10 years or so? Because it
Um,
doesn't look the way it did 10 years ago.
oh no, no, no. Funny that you bring that up. Honestly, I think that nursing will look a lot like AI driven. A lot of innovations and technology being used out there is AI based. And I think it's brilliant. I think it's great. I think anything to make our job easier for us to be able to provide safe and quality care to our patients and improve those outcomes. I think that's great. I think it's just a matter of really being meticulous when you use AI,
Mhm.
but looking forward, looking ahead, I do think that that is the future of where, you know, healthcare and where nursing is headed.
Yeah. I see it coming, like a big wave, like a big wave. Yeah. What advice would you give to someone who wants to be a nurse? Because I suspect that the advice you got is probably not the advice many people got, because you had two parents who were nurses. What advice would you give?
Um, think about what you want. Make sure that you're not doing it for any other reason than you want to do it. Like you find it in your heart to take care of people, because it's not all rainbows and butterflies, nor are you doing it for the paycheck, because girl, nope. Um, but you need to make sure that you really have a passion for it, because you're holding a patient's life in your hands. No matter what you do, no matter if you work in the ED or you work in mother baby, it doesn't matter. You're still taking care of real life patients.
Yeah, yeah,
And so be really purposeful when you're deciding to become a nurse, because you will get burnt out if it's not something you want to do.
yeah, yeah. I get you. I absolutely agree. And every time I ask that, and I ask it, one of the reasons I ask is that because I wonder, became a nurse. I qualified as a nurse just before my 22nd birthday. I became a registered nurse, which means I started, in my teens. And sometimes I wonder if we're allowing people to start too early. Because as you just said, at that time, I had no idea who I was. It was nursing that taught me who I was. Really. So that's sometimes very, very hard. But the good thing about it is that there is going to be a niche for you anyway, wherever you are. So you'll still get it. You'll still survive.
That's the beauty of nursing, though, is
Yeah.
there's so many avenues, there's so
Yeah.
many things that you can explore, and so
Yeah.
you'll find that niche that you're passionate about.
Yeah. Yes, you will. If you could describe the most essential quality of a nurse in one word,
Ah,
what would that word be?
oh gosh, there's so many words in my head. Okay, one word, Vanessa.
You can give me two.
One.
I'll take two.
I think when I think of a nurse, I think of um creativity. Nurses are very creative. Um,
Yep.
they have out of the box ideas, which I love, and which is why as a CNS, I try to really like cultivate and foster
Mhm.
that creativity and not squash it, because
Mhm.
there's brilliance behind that. And another thing is nurses have such a big heart. Like literally, you cannot work in this profession if you don't have the heart for it, as I've mentioned before.
Yeah.
But I think that's what I saw with my parents, is just that heart of a nurse that is just very distinct and very genuine,
Mhm.
that you're caring for your patients, and you're there because you truly do want to make them better, no matter what specialty you're in. So I guess I gave you two words, but like one
That's
word
okay.
being one word being creative, and the other being having a
Big-hearted.
yes, yes, whatever
I
you
get
want
it.
to call it.
Yeah. Yeah. Absolutely. Absolutely. So you are a mom of a 2-year-old. You said going on 18.
Yes. Oh gosh.
You're a busy mom. You're a mom, you're a nurse. What do you do? What does self-care mean to you? What do you do for self-care?
Oh, I do a lot of things. I do a lot of things. So my husband and I, we have kind of worked out our own schedule where we really carve out protected me time. So, I think it's just the only way we can stay sane in the daily Monday through Friday grind and
Mhm.
with a 2-year-old. And so kind of during my me time, I either go to the gym and I just kind of release a lot of built up stress there. And then I read read a lot, which is really like I listen to a lot of audiobooks. That's why I said read. But that has been my most recent pastime is listening to a lot of books.
Mhm,
But I
mhm.
do think that that has allowed me to really kind of channel the caring part for myself.
Okay. Mhm,
So
mhm, mhm.
anything that'll kind of like release the stress that you get from work, it's just, okay, this is Vanessa time with a book.
Good for you. Good for you. Audiobooks are awesome. Audiobooks are awesome. I
I
mean,
agree.
I walk a lot, and very often like you, I'm listening to a book. And the other day I was walking along where I walk sometimes is by it's along by the Long Island Sound. And it's a very popular area, actually. But I'm walking along and it's just me. And I start laughing because I'm listening to this. And this guy, not to apologize to this guy because he's like, what is wrong with you? It's like, come on, this thing is thing.
This is so relatable, but for me, it's more like I just randomly cry, like have like outbursts. And I'm just like, ah. While I'm driving to work because my commute, that's really what got me started with audiobooks, is my commute is like an hour and a half, two,
Uh-huh.
and then another hour and a half back because I
Back.
work on an island. Um,
Yeah.
but I refuse to move to the island. Because
Okay.
I'm like, you know what? It's cool. It's fine. So I turn on my audiobook and it's literally, all right, cruise control. This is actually a mini me time.
Yeah. Yeah.
Yeah. So
Yeah.
it's just that I can relate because sometimes I would be like wiping off my tears as soon as I get to the parking garage. Like, okay, get it together.
Yes, 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 indeed. I get it. I get it. Vanessa, thank you so much for this conversation. Thank you so very, very much. Before we go, is there anything you'd like to leave us with?
No, first of all, thank you for having me. I
My
am
pleasure.
really, really excited to be able to kind of talk a little bit about nursing, what makes me tick, and specifically
Mhm.
as a clinical nurse specialist, and be able to kind of share a little bit about my role. But I honestly, if I'm to leave with anything, it's make sure that you make time for yourself.
Yeah,
I'm really a big advocate for that,
yeah.
because mental health is the most important thing because you can't continue to fill from an empty cup, or you can't
Yes.
continue to pour from an empty cup.
Permanent to cap. Yes,
So
and
I'm really, really big on that. And that's something that I remind myself often too. So
yeah, yeah.
yes, that is it for me.
Thank you so very, very much, Vanessa. It's been great talking to you.
Thank you, Dale. You too.
Okay. Bye-bye.